The second lecture in Chapter 11. Hello, and welcome to the second lecture in Chapter 11's Emergency Medications section. We are going to go over aspirin today. This is, as always, Keith Woodmeyer with Wayne County EMS. Alright, let's get started. Aspirin, the generic name is acetylsalicylic acid. Trade names include Bayer, Aspirin, Aspirin, and others. It's a very, very popular drug, been around forever. Non-narcotic pain reliever. It is a fever reducer, anti-inflammatory medication, as well as a blood thinner. The way aspirin works is it inhibits platelet clumping, thus interfering with blood clotting, and that's how it acts as a blood thinner. Indications for aspirin include chest pain or other signs and symptoms suspected to be of cardiac origin, unless, of course, the patient has a hypersensitivity to aspirin. If ordered by medical direction, aspirin should be given as soon as possible after the patient's onset of chest discomfort. And in Kentucky state protocols, basics are actually allowed to administer the standard dose for aspirin, which is 325 milligrams. Technically, it's 324 milligrams. That's 4 baby aspirin tablets, which are 81 milligrams apiece. Contraindications for aspirin include a known allergy or sensitivity to aspirin, bleeding ulcers or bleeding disorders, children and adolescents. Some other contraindications include any type of bleeding that may have occurred, any recent surgery, and something to be cautious about is patients who have a history of asthma. Adverse effects include rapid pulse, flushing, wheezing, nausea and vomiting, GI bleeding, diarrhea, heartburn, loss of appetite, tinnitus, which is referred to as ringing of the ear, rash, hives, and bruising. The dosage, the adult dose is, the book says 2 to 4 81 milligram tablets, which are baby aspirin, and they are to be chewed and swallowed. I only want you to know the dose as 324 or 325 milligrams, which will be 4 tablets. I do not want you to remember the other part. So I'll even, you know what, I will draw a line through it. Because I do not want you to know that. I only want you to know the 324 milligrams. So let's get that up there. All right. Special considerations, as we said, use with caution in a patient who has any of the following, and as we said, asthma, nasal polyps, and nasal allergies. Let's see. When we are administering aspirin, open the container and pour the correct number into the inside cap of the container. Transfer the tablets by pouring them into the patient's hand and making sure not to contaminate the inside of the cap of the container. And then carefully recap the container and instruct the patient to chew thoroughly all 4 tablets. After they are finished chewing up the tablets, they should swallow them, and they may request a glass of water or something along those lines to help them. Alright.